Hello, this is Dr. David Green, CEO of the Arizona Pain Network. The topic today is the top 10 ways to avoid the need for a joint replacement. Currently, over 1 million joint replacements are performed every year in the U.S., and usually hospital stays are between 2 and 4 days. The average age of a knee replacement individual is 70 years, and there's slightly more women than men who obtain those. The infection rates are low, 1 to 2%. There is a slight risk of blood clots. Overall, though, the knees and the hips have about the same satisfaction rates, about 90%. 85% of artificial knees still work after about 20 years. Joint replacement is a quality of life procedure. No one has to have one. Because the implants don't last forever and there's a slight risk of complications, it's advisable to wait as long as possible to undergo a joint replacement. Think about it. If you're 55 and the implant lasts for 20 years and then you're 75, a revision procedure pretty much never has the same result as an initial procedure. So there's higher risks along with that. The implants are made of titanium, cobalt chrome, stainless steel. Usually it's a mixture. There are some ceramic implants, and then usually the socket, such as you see here in the shoulder, is polyethylene, which is a form of plastic. So when it comes to the 10 treatments to avoid or delay the need for a joint replacement, the first one is activity avoidance. If it hurts, don't do it, or do it less. So if you're an avid runner and your knees kill you after running, why not switch it up a little bit? Start swimming, cycling, so you don't put as much stress on the knee. Or if you're playing golf 5, 6 days a week and it's hurting you bad, just switch back to 3 or 4 days a week. The second treatment is over-the-counter medications such as anti-inflammatories, ibuprofen, and naproxen. Okay, Tylenol can help. Glucosamine and chondroitin, they're also called nutraceuticals. They're available at health food stores. Even Walmart has them. And basically what they do is they can help preserve some of the cartilage you have and help make some more. Has that been proven? Not in really large studies. Those are undergoing now, but they're inexpensive. They're pretty much risk-free for the most part, and they can help. The third treatment is when you up it to prescription medications from the doctor. This may be prescription topical creams, high-dose nonsteroidal anti-inflammatories, so you may get like the 800 milligram ibuprofen instead of the 200 milligram available in the store. Celebrex is available by prescription. It's a different type of anti-inflammatory. It's called a COX-2 inhibitor, and it's good for patients who have issues with GI and kidney problems with regular anti-inflammatories. And then short-term opiates. Long-term opiates, bad idea for osteoarthritis, but short-term is not bad for exacerbations. The treatment number 4 would be TENS units. These look like this. They're about the size of an iPod. They have wires called electrodes coming out, and they attach to foam pads that go, over your knee, shoulder, whatever the area of pain is, and it can change the way the brain perceives pain. They're very, very low risk, and they can be very helpful. Treatment option number 5 is simply to lose weight. If you're dealing with arthritis in a joint that is weight-bearing, then you lose weight, you have less joint stress, and that's less potential damage to those weight-bearing joints. Okay? Physical therapy is option number 6. If you strengthen up the muscles around the arthritic joint, it can take pressure off of that joint and then have less pain. Modalities can also be included, including ultrasound and electrical stimulation. And stretching is crucial with a physical therapy program. Acupuncture has been shown in several studies to be great for arthritic joints all over the body. Routinely, time and time again, those studies show positive benefits. Option number 8 is steroid injections. These have been a gold standard for decades. Initial studies that were done on small animals showed some cartilage damage, so people got very afraid of that, but when they went to larger animals, they did not have any evidence of joint damage from steroid, and in humans, that's never been shown either. So typically, the injections are given every 3 months as necessary. Keep in mind, though, they don't alter the disease course at all. They're basically a Band-Aid to help with anti-inflammation and pain control, but there's not a huge downside to giving one every few months, so it's a great treatment. As of recent, hyaluronic acid injections have become popular. They're made from rooster combs. They're not made from humans, but hyaluronic acid is really the motor oil in our joints. Okay, so The joints contain this naturally, and basically you're replacing that, and theoretically it actually can help promote formation of new cartilage. Has that been proven? No, but these did get FDA approved because they showed 65% good to excellent results for 6 to 12 months. And they're very low risk as well. They can either be given as a series, such as Synvisc here. Synvisc also has one now that just is given as a one injection treatment. And treatment option number 10 is regenerative medicine. This includes platelet-rich plasma therapy, called PRP therapy for short. It's where you take blood out of the arm, you spin it down in a centrifuge, and the middle layer that comes out of that is very rich in platelets and growth factors, so that can be injected. And then you also have stem cell injections, which includes either bone marrow-derived, fat-derived, or amniotic-derived injections. And that has the potential to repair or regenerate tissue in the shoulder, joint, knee joint, hip joint, which is cutting-edge technology. So the outcomes are that most patients are able to delay or avoid the need for a joint replacement for quite a while. Most joint replacements do end up fine, but there's only 90% excellent results. There's a 10% chance of having only a fair result or not being a very good outcome. And it is a quality of life procedure. Now, for instance, knee injections have over 75 to 80% good to excellent results. And it's pretty much the same with the hip or the shoulder. So there's a high likelihood that the injections will help, and they have such a low risk, it may be able to help delay the need for a joint replacement. Arizona Pain Specialists has the top pain management clinics in Arizona. They have 7 locations across the valley, the Phoenix metro area, accepting over 50 insurances. They have board-certified doctors who've won the Patient's Choice Award 5 years in a row. And the number to call for treatment is 602-507-6550. And visit us on the web at ArizonaPainNetwork.com. I'm Dr. David Green with the network. Your pain stops here.